Welcome to our afternoon session on advancing health equity through community health workers. My name is Dr. Chris Reddick. I am the Vice President and Head of Health Equity at Takeda, and I'm also a proud member of the Health Equity Compact, which is a coalition of over 80 healthcare leaders of color here in Massachusetts fighting for health equity. We'll talk a little bit more about that later this afternoon. CHWs have become an integral part of the healthcare system in many settings around the world and have been shown to decrease health disparities across the board. However, here in the US, we're still on a bit of a journey to fully embedding CHWs and creating a sustainable model for CHWs in our healthcare system. But we are building momentum. So not only this talk here and this discussion here today, a lot of the great work that these panelists have been doing in their organizations. But just think about it. Later this week, on June 15th, we'll be celebrating CHW Appreciation Day, so that's new. Last year, the Health Equity Compact put forward a bill called an Act to Advance Health Equity, which included several provisions around strengthening the role of community health workers and trying to make it more sustainable here in Massachusetts. And last year, or actually earlier this year, federal legislation was proposed called the Community Health Worker Act that was supported by Partners in Health and the National Association of CHWs on the Hill in March. And as part of our overall health equity strategy and ambition at Takeda to partner with communities to address health inequities and increase patient access to health care, we announced just yesterday an expansion of our long-term partnership with Partners in Health to improve access to care within communities across Massachusetts, including expanding and strengthening the role of CHWs. So we are building momentum. We are on a roll, both here in Massachusetts and nationally, and I'm hoping today's discussion will build on that momentum. So today I'm joined by this wonderful panel of friends, colleagues, fellow Health Equity Compact members who are all going to talk today about how we can work together to advance this pivotal work of community health workers here in Massachusetts and nationally. So let's start. I'll start with you, Christina, and ask you to introduce yourself, and we'll go down the line, and then we'll get into this discussion. So thank you all for being here.
Sounds great. Thank you so much, Chris. Great to be here. My name is Christina St. Cyr. I am the Massachusetts Director for Partners in Health US. PIHUS is really working to advance health equity in the states by partnering with community-based organizations, government partners to build up public health infrastructure that is equity-centered, and also working on public policy to really make that systems level change.
Good afternoon, everyone. I'm Sheila Och, and I am Chief Equity Officer at Lowell Community Health Center. I'm also the Executive Director of their Health Justice Learning Institute. I'm also a Massachusetts Certified Community Health Worker and a Spanish-speaking medical interpreter. At the Health Center in Lowell, we are a federally qualified health center serving over 37,000 patients each year in our greater Lowell community, and I'm able to really spearhead and oversee with an incredible team of people, over 40 community health workers in our health center.
Hard act to follow. Good afternoon, I'm Christy Mitchell. I'm a health services researcher, and I've really spent my career at the intersection of data and policy. I am the CEO and co-founder of Health Equity Outcomes. It is a nonprofit that I launched about 2 years ago with the goal of engaging with underserved and underrepresented patient populations to actually get engaged in research to advance health equity from the inside out. Something novel, right? And so we want to work, and we do work, among us, with us, for us, to advance health equity. So looking forward to our conversation today.
Hello, I'm Lisette Blondet. I'm the Executive Director of the Massachusetts Association of Community Health Workers, MACHWA, a mouthful. This is Community Health Worker Week, so I encourage everyone to seek out a community health worker and congratulate and thank them for the fabulous work that they do every day. And I'm really a member of a Health Equity Compact as well, really proud to be a member, and looking forward to this conversation.
All right, thank you all panelists. And as you can tell, we have a fantastic panel here. And I'm hoping that we've had many discussions about this and other topics around health equity, but wanted to focus today on the real importance of community health workers. So I'm hoping we bring the passion that we normally do with these conversations, and we're gonna try to keep this pretty casual and inclusive. So the first thing that I wanted to talk about is, if you look at recent data from the National CHW organization, they say there are actually 95 unique terms for community health workers. And so part of the challenge when we all go around and we talk about the importance of CHWs, I always get, are you talking about patient navigators? Are you talking about prematuras? Are you talking about fill in the blank? And so part of what I want to start off with is kind of grounding us on, what are we talking about when we say community health workers? So I'm going to start with you, Christina, and tell us a little bit about, from your perspective, and then I would love everyone to kind of chime in here on what is a community health worker in your community, in your setting, and the work you're doing.
So I don't know if I'm going to help refine the answer for you. I gave a lot of thought to what I could use for a definition of a CHW, and I could give you some sort of textbook answer, but I think it really wouldn't capture the essence of a community health worker. And so, you know, I've had the privilege to work with a community health worker from the city of New Bedford. Her name is Joanna, and I participated in a Hill Day recently with her in DC, and we were meeting with, you know, legislator, Congress people and their staff, and had a role similar to today where we're trying to educate leaders, right, on what a community health worker is. And so during those meetings, we would get the question, you know, what is a community health worker? And I think the best way is to hear from the voice of a community health worker. So I got this approved from Joanna, but what she would do, she would pull out a list and she would say, I wrote a list for you so I can tell you all the things that I do as a community health worker.
And these are legislators, right, that she's talking to?
That's right, yep. Legislators and their staff. And she would say, I'm a certified CHW in the state of Massachusetts. I'm an interpreter and translator in 4 different languages. I am a public notary. I'm a trained recovery coach, certified in mental health first aid. I'm Narcan trained and a trainer. Type 2 diabetes prevention lifestyle coach. And the list goes on and on. But it was just so powerful because that really is the epitome of a community health worker. I think CHWs, they, you know, use their linguistic, their cultural, and their technical expertise to connect communities to medical care. They help them navigate really complex health and social service systems, and they also advocate for better access to those systems and better systems in general. I know, you know, we talked about the global work, so Partners in Health has been working for the last 4 decades, you know, around the globe and building up community health worker programs. And we have worked with over 12,000 community health workers all across, you know, the globe. And PIH US, what we're doing right now is we're taking those learnings, right? What has worked well, because we know that this is a model that works and it has worked in so many other countries, and how can we take those best practices and really learn from our peers and bring them here to the United States to build more equity-centered public health systems.
Yeah, and I think that's so right, Christina, and what you said. You know, I know Joanna. I had the privilege of meeting her, and you know, one key component for me was, in addition to that laundry list, she represents her community and is from her community, right? And so all those 1,200 CHWs that Partners in Health is working with, that to a T, they're all from their communities and representing their communities, which is, you know, we heard in the earlier conversations here, so key, not only during COVID, but really in any kind of healthcare situation, connecting people to the healthcare system is going to be critical to have folks like Joanna. Sheila?
Yeah, absolutely. And thank you. I appreciate that. And it's exactly even how I started. I could have gone down the list similarly as a community health worker, right? And many of the CHWs that maybe are in this room or viewing online as well. And one of the reasons why that's so important and why we represent so many different identities is that our healthcare system is very complex, right? So when we talk about systems navigation, we have to be experts on many things, so that we can help our community navigate that. And in many ways, we are brokering between our healthcare system, which is really complicated, as well as our community in a system that for many of us, I think in this audience, and for those viewing online, if we've ever been in a situation where we're interacting with the healthcare system, in our most vulnerable state sometimes, right? That having somebody who can help educate, provide the timely education, helping us link up to resources is critical. So as a CHW, that is something that we take very seriously and are constantly seeking those certifications and that professional development associated with that so that we can be truly experts on a variety of different things, for sure.
And I really love that because as a researcher, I'm looking to see how can we leverage community health workers to actually capture data in the community itself. And so leaning into working with folks who have lived experiences, who are part of the community, who you see at the barber shop or in the church pews, to be able to collect data. So let me give you a real-world example around that. So there's a lot of focus right now on reducing maternal mortality. And so the question is, how can we engage with community health workers? Not just in terms of being that link back once a mom goes home with her new baby, but begin to sort of track and capture signs of postpartum depression, an area that is not really discussed, particularly among communities of color. But this is a really fantastic opportunity to work with community health workers who are in that community to capture those kinds of data. And the training is just add one more sort of category, researcher, because I do believe that CHWs can and should, I'm looking forward to working with them, in real research projects. So that's just, I'd like to throw that out there as another example for how we can work with CHWs.
Yeah, that's great. So I want to thank you for that, Christy. I want to transition a little into a discussion about how CHWs are impacting their communities in the healthcare system now. And Lisette, I want to hear from you. You have so much experience on this and get to see this every day, but can you tell us some examples, and I'd love everyone else to chime in on how are you seeing CHWs do their work now and the impact? And Christy, we'll come back to you with some data. We have data now coming out of COVID especially that we can take forward and say, this really does. This is an intervention. Dr. Jha was saying earlier, what are those interventions that can really have an impact? I think CHWs is one of those, and we have data now too. But Lisette, let me come to you. Tell us a story.
Oh my God, there are so many. But before I jump to stories, I want to say that community health workers are the sum of all the parts that have been mentioned. Community health workers not only have the lived experience, which allows them to anticipate many of the issues that their clients may be facing and actually go the extra mile to get additional training, like the trainings that Christina had mentioned, in order to better meet the needs of their clients. But they also go through a very rigorous training. I mean, their practice is more and more standardized. In Massachusetts, training is grounded on 10 core competencies. There is a certification. But I think that community health workers also have the magic sauce. The secret to that sauce, I think, is an abundant creativity and compassion. And that creativity allows them to use their skills and rethink their skills and do things differently every time in order to engage communities that otherwise would not be engaged and stay within the healthcare system. So one of the many ways in which community health workers impact our healthcare system, and it's not only by keeping their clients, patients healthy, but also by educating the rest of the team about the context in which health happens for many, especially for communities of color. So I want to share briefly a story from a community health worker from Boston Medical Center, a superstar, Sharon George. Sharon started as a community health worker, now is a manager at BMC. But Sharon was given a referral by a physician, and the referral said something like, these clients, hypertension was going off the charts, and the referral from the PCP said, non-compliant, African-American male, 58 years old, stable housing. Off goes Sharon to the home of a client who was non-compliant. When she gets into the home, she realizes that the stable housing is actually a room where all the client has is a small refrigerator and a microwave oven. So his non-compliance was given the context in which he lived. He could only eat canned foods or prepare foods that had lots of sodium. So she went back to her team and not only educated them about the context of the circumstances of this client, but also enrolled the client in Meals on Wheels to eat healthier meals on a daily basis.
Now, that is a great example of, again, CHWs connecting communities to the healthcare system, but it's that bidirectional piece, right? So it's not just information helping. A lot of people think of it as helping patients take away their instructions and their care from the hospital, but it really is, I like what you said, providing context to that system and the providers on that helps them adapt the care and try to close those inequities. Christy, I want to come back to you. You mentioned data, and we wanted to talk a little bit about the impact. And I said earlier, we're getting more and more data about the impact that CHWs are having. So they're going from stories to real data. So maybe you could talk to us about that a little bit. I'd encourage anyone else on the panel to jump in with your stories or data around the impact you're seeing at your institutions.
So just we were talking in the green room, and Sheila has an amazing story to share. So I don't want to steal your thunder on that. But the long and the short of it is that I think there's a piece that was published last August. It was in 2023. It's an annual review of public health. And in there, it really categorizes and provides a phenomenal overview of the impact of CHWs. And it talks everything about CHW-led interventions leading to reduction in A1C, better lipid management control, antiviral medication adherence for people living with HIV, pediatric asthma. It talks about increased rates of cervical cancer screening, breast cancer screening, colorectal cancer screening. I mean, you name it, and you're seeing, glimpses of the magnitude of that impact. But wait, there's more. There's the ROI that's really now becoming to be uncovered. There's a randomized controlled trial among Medicaid patients in which for every dollar spent, it was $2.47 savings. That's phenomenal, right? But we need more. And so I don't want to be the Debbie Downer in the room, but I have to tell you that without data, you can't get policymakers to make change. And right now, there's an issue around sort of the rigor of the studies that are being conducted. So I want us to be clear that there are a lot of studies. There are over 500 studies that have been published, right? But there's a question on the table as to whether or not the studies have an appropriate comparison group. Most of these studies do not. There's a question around, are they using RCTs? Most of them are not. But the one major factor that I have to sort of highlight for you guys is that all this wonderful description of how the term CHW, the flexibility in that term, it leads to heterogeneity or a lot of variability in every program that's being tested. So I can't pool that data together and tell a robust story because of just the nature of the program, which is like a blessing and a curse, right? So I throw that out there because as a person who I live and die by the data, I want to make sure we can tell the best story possible because I can tell you all these my colleagues here can give you story after story of all the wonderful work, but as a policymaker, they're going to be asking a little bit slightly different question. And so I just want to point that out there that we have an opportunity moving forward, right, to design studies with this in mind, that we have to keep the audience in mind and the stakeholder in mind to build the most robust studies possible. So you tell your beautiful
I appreciate that, and I do have a story, and it does have data that has been statistically analyzed and is significant, and that is at the health center, we had funding. This was working in collaboration with the University of Massachusetts Lowell. I want to give a shout out to Dr. David Turcott and Mercy Anampio and Carla Caraballo, two CHWs that spearheaded this program for many years, and it was on pediatric asthma. And we had a cohort of about 100 patients or so within that program, and our community health workers were critical to that, conducting home visits, home assessments, doing mitigation in the home for asthma triggers, doing educational components, education with the family, as well as our clinical care teams working in collaboration. And with that program, we saw an over 80% reduction in emergency room visits. And that netted a savings of over $500,000 with just that one intervention alone. So for us, right, to be able to bring that, and that's one example of so many. We have community health workers right now at the health center embedded into almost every single program, and I'm sure as we're measuring some of these things, netting the same savings into the healthcare system while improving health outcomes of our community, for sure.
Oh, that is really impactful, and that data is out there. And I think one thing to close out that little bit of discussion I hear from CHWs and communities is be sure to bring that data to the community, right? Mm-hmm. Be sure to share it. Don't let it sit, at a certain level, but let's have a dialogue around that. So I want to use the last little bit of time here to talk about the future, right? So hopefully we've convinced everybody that CHWs are one of those interventions that can really make an impact in health equity and closing the equity and disparities gap. But this next part of the journey is going to be hard, right? So I want to talk about what do we need to do? What are some of the key things we need to do to expand CHWs, right? We talked about use in communicable diseases, in non-communicable diseases like hypertension and diabetes, starting to see CHW work in cancer care. But what we've talked about is they can be impactful across the board, right? So let's go around and talk about what do you think are some of the key things that not only we, but this community here, that we all need to lean in together with to expand and improve and really embed CHWs into our healthcare system here in the U.S.
3 things.
Let's hear them.
Many, but I will summarize it to 3. SSB, sustainability,
Yes.
standardization, and voice. And what I mean by sustainability is that in spite of the very robust evidence that we have about the role of community health workers in meeting or accomplishing the triple aim of quality, savings, and
Experience.
patient experience.
Patient experience. Well, that went later. But anyways, no, but there is no one doubt about how much community health workers improve the health of our clients and at the same time are saving the healthcare system millions of dollars in clients do not go to the ER as much with an asthma attack because now they are adhering to their primary care doctor. Patients with TB are adhering to the regimen of their medications, but it still is not funded. So every summer, community health workers, many of whom are grant funded, fear for their jobs. They have a job this year, but they may not have it next year. More and more community health workers are employed in primary care settings through bundle payments. But again, we are all in transition. This is all an experiment. So I think that we need to match the data with the money that we will have to make these folks permanent members of healthcare and social service teams. Standardization. I cannot tell you the number of community health. I mean, one of the reasons that we have so many titles is because very, very well-intending employers think that they are going to create a name for the profession that is better at describing what they do. Well, thanks very much, but let's adopt one and let's all adhere to that. And let's create job descriptions that really are standardized, that respond to best practices. There is ample evidence about what is a good community health worker model and what is not. I mean, what I was saying earlier about the sum of its parts, being just a member of a community is not enough. You need the training, you need the creativity, you need the knowledge of the healthcare system. So let's make sure that community health workers are able to practice their field within those parameters that are standardized. And last, voice. I think that community health workers need to be defining their future, their careers. There is ample hard data, but there is ample anecdotal data that we are yet to get. And I think it's really important that we do that we invest in getting data about the vision of a future based on community health worker real practice.
Lisette, I love that. SSV, folks. Christina, let me come down to you. I know Partners in Health is constantly thinking about this. CHW is not only here in Massachusetts, the U.S., but internationally. So, and you've also been involved in policy work as well. So what are your top issues that you're thinking about in terms of how do we continue to support the expansion of CHWs?
Yeah, well, I love what Lisette said. I love that you teed up earlier what I'm about to say, and policy is my favorite topic because policy to me is how you make something sustainable. And so I know we don't have a lot of time left, so I just want to talk about too many things. But you also have to do policy at multiple levels. So PIH is partnering with the Mass Association of Community Health Workers right on state level policies so that we can both sustain and standardize CHWs in the state of Massachusetts. And then PIH US is also working with the National Association of Community Health Workers on the CHW Access Act that was filed just this last spring. And this would really bring a more sustainable set of funding sources for reimbursing CHWs through Medicare and Medicaid. And I think it's not only going to provide an improvement in support of the CHW workforce, but as we've heard today, it's also going to improve the lives of patients and communities. So I can find me after, and I can tell you how to take action in supporting that legislation.
Absolutely. Thank you for that. Sheila and then Christy, let's close us out. What are your thoughts on where do we go from here with CHWs?
Well, ditto and ditto to what has been said. I agree with all. And I will say the one thing is, as I was reflecting on this panel, what's important is for us to recognize that CHWs are indispensable in healthcare. That's one. And then the second component is that equitable access to healthcare services is not possible without CHWs. So everything that we talked about, whether it's taking positions and supporting policies, policy recommendations that so many bodies, including the Health Equity Compact, is pushing through, what you're talking about as it relates to data and standardization, and all those pieces are critical as we center community health workers in our healthcare workforce. Very important.
Yeah, that's very important. Christy.
I actually don't have anything else to say. I mean, I think that they
said it all.
They did a rock solid job. I mean, so thank you. But one thing I would like to leave you guys with is this notion of innovation in the role of CHWs. I mean, we talked about this on our prep call. You know, can we introduce this concept of CHW training to high school students, right? And begin to create a whole culture around being, you know, in the space of being a CHW. at that level, such that the training is almost intergenerational. You can imagine coming back home and sharing with their parents and with their grandparents what they're learning. And it's an introduction to healthcare as a career, right? So I just throw that out there because it's not sort of the traditional for CHWs, but we know that it's worked. We know that it was tested in Morehouse School of Medicine, rolled it out in 2015, and they're like on their 5th cohort. And so I just say that innovation, like, let's not be afraid of trying something different. And I'd just like, that's my final comment.
I love that. I love that. So I'm looking at the questions here. We have so many questions. And so we've proven one thing. This topic is really of interest and important to folks in the health equity space. So I'm proposing that we do it again soon. So this fall, we come back together and we pick up on this conversation. And I'll just close with that. In my experience, I've had the privilege and real honor to be able to have deep discussions and engage with the panelists here, many of you in the room who are working in this space, especially through the Health Equity Compact. To me, we have to keep this discussion going, right? So continue to talk about community health workers. So many different stakeholders are involved in this that it's going to require us all to come together to try to move the needle on the things you guys talked about: sustainability, funding, policy. So I encourage you all to do that and continue to help us on this journey and keeping the momentum. So thank you. Thank you all.
Thank you.